All right, so to gauge exercise intensity during cardiac rehab, clinicians often utilize the RPE scale. Again, this is a subjective report based on sometimes off a 0 to 10 scale, although the original scale was from 6 to 20, 6 representing roughly patient's resting heart rate, 20 representing roughly the patient's max heart rate, or 200 representing their max heart rate. But patients found that confusing, so often you'll just see a 0 to 10 scale. Oftentimes descriptive words like light, hard, and very hard are used and correlate highly with different numbers on the scale. And also different numbers on the scale correlate pretty highly with specific heart rate ranges. So an RPE value of 5 to 6 correlates pretty highly with roughly 60% of the heart rate range of the patient, whereas a RPE of 9 correlates with roughly 85% of the patient's heart rate range. So it can be a quick and accurate, relatively accurate way of assessing what percentage of their heart rate range the patient is exercising at. All right, so here are the two scales. Again, you have a 6 to 20 scale or a 0 to 10 scale. And again, sometimes these descriptors correlate really well with specific numbers on the scale. For cardiac rehab, you want to have the patient come in at least 3 times a week, but generally 3 to 5 is most common. Patients should not feel increased fatigue as a result of exercise. So while you are trying to make an adaptation to the system as a whole, the system should be catching up to that level of stress. So if the patient is recovering from surgery, they should continue to gain energy even while adding in cardiac rehab and increasing the intensity of cardiac rehab. Their fatigue level should not increase as a result of increase in cardiac rehab. If it does, then potentially you want to scale back on the frequency of the exercise. Exercise duration, generally 30 to 40 minutes with an additional 5 to 10 minute warm-up and cool down. Deconditioned patients may require interval work with brief periods of rest every 5 minutes during early training. And again, it's essential that you have adequate warm-up and cool down periods with patients who have coronary artery disease. And again, that's generally around 5 to 10 minutes of each. All right, so exercise mode, again, exercise mode refers to the type of exercise that's being done. And lots of different types of exercise can be done with cardiac rehab. Walking and use of exercise equipment is most common, although you can do other stuff like swimming and other forms of cardio. If a patient becomes symptomatic with angina, just a quiz question for you, kind of mid-presentation quiz question. So if a patient becomes symptomatic with angina during exercise, what do? All right, if everyone should at the same time in unison say stop exercise. So you don't want to exercise if a patient starts reporting angina. You want to stop exercise. All right, so we're going to go through the different stages of cardiac rehab. You have phase 1, phase 2, and phase 3. The first phase is the inpatient phase, while the second and third phase are both outpatient phases. It's crucial to monitor heart rate throughout all 3 of these stages, but we'll talk more at length what else you might be monitoring in different phases. All right, so phase 1 or inpatient phase occurs in the hospital. This is following stabilization of the patient's cardiovascular status. after MI or coronary bypass surgery or other cardiac surgery. And this generally lasts 3 to 5 days. All right, and purpose of this, the purpose of this really is to educate the patient and the family, and to help prepare the patient and family to for their return home. You also want to educate the patient on different behavior modifications that they can do to decrease the total cardiac load that they are experiencing. So ways of decreasing stress, ways of saving energy and being efficient with the energy, or efficient with the activities that they do carry out. This phase does not generally include formal aerobic conditioning. All right, as opposed to doing formal aerobic conditioning, this phase generally includes doing more informal activities to help the patient and prepare them to leaving the hospital and going home. So self-care activities, sit to stand activities, or helping the patient with transfers, ensuring that their gait is safe and that they can tolerate, at least household ambulation. And then, again, you want to prepare the patient and family for discharge. During this phase, the patient is monitored via telemetry. Telemetry is use of special equipment to track the patient's heart rate, blood pressure, breathing, and other vitals. All right, phase 2 is the first outpatient phase. It is initiated upon discharge from the hospital, well, it's not always initiated, but depending on the diagnosis, it can be initiated at discharge from the hospital. Like phase 1, patients are monitored via telemetry. Blood pressure is recorded at rest and during exercise during this phase. Ventilation responses are also noted. And this stage usually lasts up to 8 weeks post their cardiac event, whether it's surgery or MI, if they had a acute injury or surgery that led to their cardiac rehab. Purposes of this phase include you want to be able to safely progress exercises towards independence. You want to enhance cardiac function, and you want to determine the effects of different medications the patient is on, and also as a way of relieving anxiety and depression. All right, so during this phase, so still on phase 2, this includes predominantly aerobic exercise. So this is where your formal aerobic conditioning begins. Patients often attend sessions 3 times a week. Initial intensity is low, so 40 to 60% of max heart rate. And duration is initially anywhere from 10 to 15 minutes, but progresses up to 30 to 60 minutes. Again, with a 5 to 10 minute warm-up and cool down. Strength training, so this is the stage where you can begin some light strength training, emphasis on the light, starting with weights, 40% of the patient's 1 rep max effort, so quite light. And then as they progress to phase 3, then they can increase the intensity of their strength building program. All right, it's also important to note that the type of aerobic exercise that you choose to do in this phase might be dictated by the presence of sternal precautions. So if sternal precautions last, as long as the doctor, until the doctor discontinues them, or around 6 weeks. So the phase 2, which lasts up to 8 weeks, you could potentially have a scenario where the patient's sternal precautions are lifted, but they're still in phase 2. Just be aware that in general, with phase 2, the patient is likely going to have sternal precautions, so you wouldn't want to do a lot of exercises that place stress on the upper extremity, place stress on the sternum. You wouldn't do, you potentially might not do an upper body ergometer, or you might not do a rowing machine, or you wouldn't do a rowing machine. And you wouldn't want to do swimming, because those things are all going to place stress on the upper extremity and place stress on the sternum. All right, final phase is phase 3. This includes a supervised exercise conditioning program. During this phase, heart rate and rhythm are no longer monitored via telemetry, but patients are reminded to monitor their own pulse rate, and supervisory clinicians are available to monitor blood pressure. Purpose of this phase is to continue to improve and maintain fitness levels. All right, mode of exercise in this phase, again, with generally sternal precautions being lifted by the time patients get to this phase, other modes of exercise become available. So like swimming, hiking, jogging approximately 5 miles per hour, cycling approximately 12 miles per hour. These all can be done during phase 3. All right. All right, so really quickly, we'll go over some special considerations. When working with patients in cardiac rehab who have congestive heart failure, it's important to keep in mind that you want to keep the intensity low, and you want to gradually increase the duration of their session as the patient tolerates. You also want to keep exercise heart rate below 115 beats per minute, and monitor their oxygen saturation via a pulse oximeter. All right. Next special consideration we'll discuss is patients who have had a heart transplant. So heart rate alone with these patients is not an appropriate or accurate measure of exercise intensity. The heart has been de-innervated, so it's no longer receiving sympathetic or parasympathetic input. So better and more accurate means of tracking exercise intensity would be things like RPE and blood pressure. All right, and then finally, patients who have pacemakers or automatic implantable cardioverter defibrillators, you want to avoid upper extremity aerobic or strengthening exercises initially after they've been implanted. And that's done. You want to avoid essentially shoulder flexion above 90 degrees on the surgical side until cleared by the MD. So if the patient, if it was implanted on the left side or the incision was on the left side, then they can raise their right arm above 90 degrees. They just, you wouldn't want them raising their left arm above 90 degrees. All right, and finally, I want you to be able to calculate the patient's exercise heart rate using the Carvonin formula. We discussed this briefly last semester in lab. A Carvonin formula is based off the heart rate reserve, essentially the difference between resting and maximum heart rates. You can see the formula here. So what I want you to do is pause the video, read the scenario below, and go ahead and calculate the patient's exercise heart rate. So go ahead. All right, and here is the math. So essentially, you should have been able to come up with 118 beats per minute. So I do want you to be able to do that. All right, and then finally, again, I want to stress the importance of warm up and cool down. Warm up and cool down, 5 to 10 minutes each. Heart rate within 20 beats per minute of the target heart rate. This decreases the risk of arrhythmias for the warm-up, and for the cool down prevents myocardial ischemia and arrhythmias.